Hello everyone. So today we will be discussing another topic in one concept a day, and so let's start it by answering this question. So here is a spotted image that you can see, and this is the question: which of the following is true regarding this? The causative agent is a fungus. The incubation period of this condition is 4 weeks. It commonly occurs in children of 2 to 12 years age, and HP bodies are intranuclear inclusions. So to anyone who knows the answer, please just mark it up, and to people who don't know what this condition or what this spotter is, tune in for the video. So what this right here is known as a condition known as Molluscum Contagiosum. So that was a classic image of the condition of Molluscum Contagiosum. So what is the causative organism here, which answers the first question that we had, first option that we had? It is known as pox virus. So this is a viral infective agent and it is not fungal. So there are 4 viruses here in this class, which is MCV1, 2, 3 and 4. So here the first one, MCV1, is most prevalent, and the second one is usually sexually transmitted. So these are the 2 things that you need to know about the classes of the virus. So most commonly the age group which is affected is children. So children of the age of 2 to 12 years are usually affected. Here is the gross image of this condition, and this is the microscopy, which I'll explain in the further slides. So how is the mode of transmission? So in children, this is usually transmitted by direct contact or sharing of articles, and in adults it is usually sexually transmitted, and hence the lesions are usually seen in genitals, lower abdomen, inner thighs, and the incubation period of this virus is 6 weeks. Please remember it's not 4 weeks as given in the option, it is 6 weeks here. Coming to the most important yet the diagnostic thing of this condition, which is the gross appearance and the microscopy. So how does this image present to you? This condition presents to you with a pearly dome shaped papule with a umbilicated center, also known as a dimpled center. So if you see here clearly, this is a dome shaped lesion with an umbilicated center, right? And that is how this image looks like. And when you come to the microscopy, you see a characteristic finding which is known as Henderson-Patterson bodies, which are the intracytoplasmic inclusions. Please remember it, they don't have intranuclear inclusions, it is intracytoplasmic viral inclusion seen in this condition. So how does it look in under the microscope? So usually as we had seen in the previous classes, most of the people who have seen it know that this is the epidermis, and this is the epidermis, and here what you see is the dermis. So in this cut it has not come, but if you cut the sections a bit more higher, you will see that the epidermis will invaginate into the dermis, forming a cup shaped lesion. So there will be hyperplasia of the epidermis into the dermis, and then inside it you will see these viral bodies. So this was one image of the condition. This is again another same condition but in another patient. If you see, there are numerous eosinophilic inclusions. As you can see, all of these are pink. So this is pink in H&E. Pink is eosin, so it is eosinophilic. And again, since this is a viral condition, it is viral, and since it is inside the cell, it is known as an inclusion. So it's an eosinophilic viral intracytoplasmic inclusion. So please remember, the viruses have a lot of inclusion bodies. However, you will distinguish it based on whether it is eosinophilic or it is basophilic, is it intracytoplasmic or it is intranuclear. So here is one condition where you see intracytoplasmic eosinophilic inclusions. Again, this is the high power of the same. This is inside the cytoplasm. See, if you can see this, the nucleus is outside and outside the nucleus, you see, it's an inclusion. So all of these, okay. So this is intracytoplasmic viral inclusions, also known as Henderson-Patterson bodies of the same thing. So another example of intracytoplasmic viral inclusion is Negri bodies in case of rabies. And here is the entire thing that you needed to know about Molluscum contagiosum. So let us now answer this question. Which of the following is true regarding this? So for you to answer this question, you need to know what is this condition, and since we have already discussed it, it is Molluscum contagiosum. So what is the causative agent? Is it a fungus? No, it is a pox virus. So this is not true. Again, the incubation period is 4 weeks, which is again not true because we discussed it. It was 6 weeks. And then finally, commonly occurs in children of 2 to 12 years, which is true. And HP bodies are intranuclear. No, they are intracytoplasmic viral inclusions. So that is all for today. Hope you understood this small topic. Thank you.